Of course, we can't forget the enormous toll the pandemic has already taken. This afternoon, EVMS paused to remember the victims of the virus, as well as the people who have been on the front lines since the beginning. 10 on your side, Stephanie Harris joins us now with that story. Steph, an important one.
Yeah, when you lose someone, you know, it is really important to grieve, Anita. And doctors, nurses, and other healthcare workers haven't had time to do that over the last 16 months. Today, they took a moment to remember the ones they couldn't save.
Somewhere over the rainbow.
Like the pinwheels planted to remember COVID victims, the last 16 months have been a whirlwind for hospital and healthcare workers.
There were times at which it was overwhelming, that everybody was exhausted, and yet they've got such dedication to what they're doing that they stayed. Some of the nurses were working extra shifts. Residents were going over their duty hours.
Dr. Linda Archer brought the idea of a remembrance ceremony to the grounds at EVMS.
And I know a moment's not a long time, but it's something.
Centera Norfolk General Hospital saw more than 1,250 hospitalizations and 131 COVID deaths.
We'd like now to ask to honor a moment of silence for those that were lost in the pandemic.
The ceremony also honored those on the front lines.
Having that moment to debrief, to process what did we just go through, and you need that.
Dr. Marisa Castillo said after months of putting emotions on hold, burnout and depression are setting in. It's time, she says, to let it all out.
Where troubles melt like lemon drops.
There is hope beyond the grief.
Luckily, it's gotten better, but still, you know, we worry, is there going to be a surge because not everyone is getting vaccinated?
The plea here is get vaccinated because it really saves lives, it saves hospitalizations.
Over the rainbow.
Dr. Francis Councilman, who you just saw there, said that healthcare workers have not been able to properly mourn for two reasons. One, the patients keep coming. And two, pandemic restrictions kept them from doing what people do to process grief, getting together with family and friends for support. Anita?
And that grieving process is so important. Thank you, Steph.